An Ebola epidemic was declared in Guinea-Conakry on March 22nd. This is the first time that the virus has been detected in the country. MSF has set up an isolation facility for suspected cases in Guékidou and is preparing to do the same in Macenta. Both cities are in the region of Guinea Forestière in the southern part of the country. The Ministry of Health has recorded nearly 90 suspected cases to date, including approximately 60 deaths. Ebola is a rare but serious illness and is often deadly. Ebola spreads quickly through direct contact with infected individuals or animals. There is no treatment for the Ebola fever, and it is fatal in 25 to 90% of cases. The Ebola virus causes a raging fever, headaches, muscle pain, conjunctivitis, and general weakness. The next phase involves vomiting, diarrhea, and sometimes a rash.
The numbers is going up rapidly, faster than what we thought, forcing us to adapt our plans and our strategy on a daily basis. It is really an extremely challenging situation for everyone. And MSF, we can't do more than we're doing now. We've opened this center a week ago. It's completely full today. We are desperately trying to get more beds. We have bulldozers and rub holes getting up. We're recruiting staff, we're training staff, but we would like to do much more, but our first priority needs to be the security and safety of our staff. So we can't go faster than what is safe. Ebola today is all over the city. All areas, all districts of the city today have people dying and people getting sick every day. So the population has turned and they are now afraid. They are asking for help. They don't know how to respond to this, because if they call the hotline, nobody will come and pick them up because the system is completely overstretched. There are too many and the response is too weak. It's very important to understand today this is more than an Ebola outbreak. Today we're facing a humanitarian crisis and it's evolving in front of our eyes and it's getting worse every day. The healthcare system has more or less broken down. Hospitals are closed, clinics are closed, some of them have reopened, but the staff is afraid to go back because they're afraid to get the disease. There's been too many healthcare workers who died. It's not only Ebola that is a threat to people's lives, it's all other diseases as well.
L'Ebola est très contagieux. L'Ebola est contagieux par les fluides d'un patient avec l'Ebola. C'est pour ça qu'on doit éviter d'être en contact avec le fluide d'un patient. Donc le fluide, ça veut dire le vomissement, la diarrhée, le sang, la salive, le sueur. Donc pour nous protéger, on a des vêtements spéciaux. Donc on a tout. On a des boots, on a le pantalon comme ça, on a le apron, on a le masque, parce que quand tu parles avec un patient et il y a des salives, c'est aussi très contagieux, donc c'est pour ça qu'on a le masque. On a deux paires de gants, un normal et un surgical. Et aussi après on doit mettre le Google. Et après nous sommes prêts à entrer.
Although there is no cure for this disease, we can reduce its very high mortality by addressing the symptoms. For example, we put patients who are dehydrated from diarrhea on a drip. We give patients vitamins and pain medication, especially when we are dealing with a hopeless case. At this point, we ease the patient's pain and stay with him until the end.
C'est très difficile de voir la souffrance des patients sans pouvoir faire quelque chose. C'est très difficile de voir les patients mourir.
Together with the local community, MSF is also focusing on tracing people who may have been infected by contact with already identified patients. Affected communities must also be informed about the illness and the precautions to be taken to limit risks of contamination. Basic hygiene, such as washing one's hands, can greatly reduce the risk of transmission.
Since January, nearly 600 cases of Ebola have been confirmed in Guinea, Sierra Leone and Liberia. The meeting held in Ghana shows that the region's health ministries recognise the scale of the outbreak. Working in all three affected countries, MSF hopes that this awareness will convert into concrete action because the outbreak is far from under control. The teams in Guékidou in Guinea have treated 130 patients and 31 have recovered, like this young boy.
He's bitten now. We've just told him that the test results are confirmed. He's negative. So now he'll go for his last disinfection shower, and then we'll take him back to his village.
Communication is key to combating Ebola, as fear and stigmatization must not prevent the sick from going to health centres. Each time a recovered patient returns home is an opportunity to raise awareness among the community. The sooner a patient receives treatment, the greater the chances of survival.
I'm Beverly Kirk with the Global Health Policy Center, here with Dr. Steve Morrison. He is the Senior Vice President and Director of the Global Health Policy Center here at CSIS, and we're talking about Ebola. The CDC says the Ebola outbreak in West Africa is now the worst in history. And talk about this, explain the broader significance of this outbreak and put it in some context. If this is the worst ever, how does, what about previous ones?
This is the 11th or 12th outbreak dating back to the mid-70s, which was the first outbreak in then Zaire. This is far and away the worst we've ever seen. It's over 1,200 people that have been affected by this, become ill, over 670 fatalities. It's also very unprecedented in that it began in Guinea. It jumped into 2 neighboring states in the last few days by virtue of an air flight. It jumped into Nigeria. So the scale and scope of it is 2 to 3 times the levels of anything we've seen. Mm-hmm. The fact that it's multi-country, that it's region-wide, and that it's spreading, and that we have been unable, since this was first confirmed in March, to really bring it under control.
As the medical world continues to grapple with Ebola, there are growing calls for experimental medicines to be used more widely. 2 American aid workers infected with the virus appear to be improving after receiving an unapproved medicine, ZMapp, ahead of their evacuation back to the United States.
This is an emergency compassionate use situation. This is not a well-controlled laboratory study. A lot of work remains to be done to see how it worked and why and how quickly. The apparent speed of recovery was faster than I would have expected, so there may be a lot of things that we still don't understand about the virus.
The antibodies were originally harvested from mice that had been injected with parts of the virus. Experiments on monkeys suggest the antibody cocktail may reduce fatalities when given after exposure to the virus. The proteins are then grown in specially modified leaves of tobacco, which act like a photocopier, reproducing larger amounts.
I do agree there's no vaccine. Treatment is experimental. The real way of stopping it is by transmission of the virus, which we know quite well how to do. It's just spreading that message and then providing basic supportive care to people who are being treated at the moment. What we must remember, it's a very isolating and stigmatizing disease, and people deserve to be treated with care and concern, which is what we're all committed to.
The Spanish government is sending a specially equipped plane to Liberia to evacuate a priest who is infected with the virus in the capital city, Monrovia. The World Health Organization will announce on Friday how it plans to slow down or halt the global spread of a virus that has claimed 900 lives in West Africa since February.
Are there special factors that are driving the way that it's spreading this time?
Yes, there are. West Africa is these countries that are affected are a pocket of countries that have exceptionally weak health infrastructure. Mm-hmm. They're exceptionally poor, and they've had exceptionally poor governance and leadership. So that is very fundamental to the spread, the fact that this could ignite and spread so rapidly. Mm-hmm. Second is the proximity of the jungle to the urban, densely populated areas. We don't know exactly what the reservoir is for Ebola, but it is emerging out of a jungle environment, and it's jumping. Those are 2 of the principal factors that are driving this. It's showing us globally that while there have been significant gains in many countries in the world in building the capacities to surveil, mm-hmm. to prevent, to detect outbreaks, to respond effectively to outbreaks, we have these important pockets like West Africa where those capacities do not exist, and it creates a large vulnerability to this kind of wildfire.
So how do you get it under control, since in some cases you have doctors who are also contracting this virus and people are panicking and NGO personnel are either being kept at bay or actually being attacked?
It's going to take time and it's going to be difficult to get this under control, but we know what has to happen. We know that there needs to be a public communications program across this region to rebuild trust and to inform people, and to get people to agree to cooperating in those that are ill or those that are dying, separating them. They have to be separated and isolated. There has to be a containment strategy, and there has to be contact tracing. In other words, you have to isolate and contain, and then you have to detect exactly who else was exposed, and then work on that. And then you have to share data across the region. Those steps have to happen. The capacity is not there, and things have gotten very, very difficult for the reasons that we've discussed. So this is not going to be fixed quickly. Right now, it's pretty much out of control. The WHO has come in a few weeks ago and is establishing a regional center, a hub. CDC is bringing in additional teams and capacity. The governments within the region are on high alert, and they are beginning to recognize that this is a threat to their basic stability and functionality. So we will see this arrested eventually, but it's going to be tough.
I was called by the office to go ahead and see if I could go back to Central African Republic, where I've been a number of times. And I knew that the Ebola outbreak was spreading and that they were looking for support. So I asked if I could be deployed to the Ebola outbreak and was accepted, and I was there for 5 weeks. This is my third viral hemorrhagic fever intervention, and I saw the benefits for both myself as a professional and personally, but as well as being a support person for the national staff on the ground. Because I know we can do it safely, and I know we can do it well. And MSF has proven that to me over and over again. It started at about 6 o'clock in the morning when you went to the center to do your lab draws. So the first time that I did a blood draw with a colleague, I was kind of supporting him. It became really real at that point of how deliberate and how mindful I needed to be every step of the way. Moses is a really nice young man who's about 8 years old, and he came in. He was really, really sick, really, really sick. He came in with about 20 people one night, and all of his family had died. He was kind of thrown in an ambulance and sent to the center. When we identified him, he was dehydrated, he was vomiting, he was stooling, he was refusing to eat. And the team just never gave up on him. We just continued going to him day after day, hour after hour, encouraging him to eat, encouraging him to recover. He didn't look like one that was going to make it. He looked like one that was going to be not long for this world, but he recovered and danced out, and there's some great pictures of him. So he was just an inspiration for me to be able to see where you could start and where you can end with this disease. It's the first time I've ever really realized that hope was such an important part of medicine.